One of the reasons I came to Brentwood was I wanted to bring New York City medicine to Brentwood.
Hey everyone, Krista Mashore.
Josh Vitale.
With eXp Realty and the Mashore Group, formerly Homes by Krista. We are here in Brentwood showcasing another fine business, Dr. Beer with Balfour Dermatology. He does everything from wonderful skincare prevention as well as Botox. Don't say anything, but I know somebody that does that. Anyways, it's amazing. I've been going to him for years.
You name it, he does it. In fact, what I had done to my face is I had a skin treatment done for cancer lesions, and Dr. Beers wants to showcase one of the things that he recommends to be done when you have skin issues like myself. And so we wanted to showcase that and showcase all the things that he provides.
And most anything, be sure to be careful. Use sunscreen, because when we show you what happened to him, you're gonna want to pour that all over your body. Come on in, let's take a look.
All right, come on in. This is the famous Dr. Beer, and he is the master when it comes to skin. And so when I sent him a picture of what I did to my face, he said he would love to assist and kind of talk about what he recommends and what he does for people that have basal cell carcinoma, I believe.
Right.
I had a process done called fluorouracil that basically peels off portions of the skin that have bumps and those types of things. Take it away.
So precancers and skin cancers are a very common condition. They are rising in frequency. So when our parents were kids, the rate was only about 20%. And now for people today and kids born this year, the rate is 50% by the time they're 60. And so it's increasing. So there are many things that we can do to treat after they occur, but also to prevent. Fluorouracil is used for prevention as well as treatment, and there are two ways to do it. There's the FDA prescribed way, which is how you had it done, and this is where you get what we call tomato face.
Yeah.
And the tomato face is something where you can't work. It's very hard to go outside, no matter how brave you are. It really is the more sun damage you've had, you get more things that look like tomatoes on your face.
He looked like Deadpool. You see the movie Deadpool? That was it right there, Deadpool.
So there's a way. I trained in New York City, and in New York City we couldn't have people walking around like that, and so I guess you could, but we wouldn't.
Yeah.
Right. And so we did the executive treatment, and that, instead of doing it twice a day as you were doing it, we would do it just once a week. And it takes a little bit longer, but then no one knows you're having anything done. And so one of the reasons I came to Brentwood was I wanted to bring New York City medicine to Brentwood, because in a community like Brentwood, I feel like I can really give back to the community and bring first-class medical care to Brentwood. And so we have a lot of different ways of doing things, as you would imagine, just as New York City does things differently than other places.
So you're saying you want to bring the New York City type of treatment, like celebrity status, taking care of people, to Brentwood, our hometown. I love that.
Yes. So yeah, many people think of us just as cosmetic, because we do Botox and lasers and all the fun stuff, but also first-class medical care. So for precancers, as you know, we have a very sunny climate. We have 1,000 miles of waterways so close to us.
Right.
Everyone has a pool and a boat. Not everyone, but a lot of people do.
Yeah.
Right.
And so there's a lot of sun exposure. And my goal is not to tell people not to go out in the sun. We live here for a reason.
Yeah.
Still to go out in the sun, but to do it safely, wearing sunscreen, and also thinking about, especially when you've had precancers, or thinking about how to prevent treatments so that we don't have to go through treatments for skin cancer.
So when you talk about wearing sunscreen, how what is the level of sunscreen that should be worn, and how often should it be put on?
So first I want to start with sunscreen is safe. There are a lot of confusing stuff out there, and sunscreen is very safe to use. We recommend an SPF of 25 or above, and reapplication every 2 hours if you're going to be outside. And so a lot of people will start, and I was quoted before across the nation on one comment. One person they had 3 dermatologists. One was talking about how there was one certain sunscreen that was the best sunscreen and everyone had to buy it, and it was a very expensive sunscreen. And another one had another idea of what the best sunscreen was. And I said the best sunscreen is one that you will use.
You wear.
Agreed.
And so it's going to be different often for the wife is different than the husband on what's best for them. And so for me, when I go to Hawaii, I'll start with a cream sunscreen, but then I'll augment those every 2 hours with a spray sunscreen, one of the sports sprays. So it's easy for me to do, and I don't have to keep the family waiting while I'm putting on sunscreen, because it takes me a long time, because I realize...
You're a big guy.
Well, I realize you can get it every little curve of your face, you can get skin cancer. So you just put my ears, it takes me 20 minutes to put it on my ears, because there's so many little curves, and I got to make sure I get it everywhere.
So here's the kind of a sort of overlap, or reiterate what he's saying, is like preventative care is the best care, but he has a better way of taking care of it if you actually get skin cancer. And the second somebody thinks they have it, what can they do like to even prevent? I know, do you do like the regular checks where they check moles and check your body? Do you do that as well?
So I think it's important for everyone to get a yearly skin check. And if they've had skin cancer in the family, I think it's important for them to do even more often, depending on what their first mole exam looks like. And then we have some people who had skin cancer in the family whose parents may have had many skin cancers before. We've been able to prevent them from getting a skin cancer well until their 60s or 70s. Except I have many patients who have never even gotten a skin cancer, even though their parents had one. And we do that customized treatment for them, which includes creams, but also treatments for the spa, because the spa also helps rejuvenate the skin and helps remove skin layers. And then sometimes we'll use lasers or prescriptions, as Josh had.
Oh wow. Okay, so Brentwood, East County, take care of your skin both before and if something happens, come see Dr. Beer. Now he also does other fun stuff. He was saying fun things. When you talk about fun things, and ladies, if you're like me, you know what he's talking about. What exactly does that entail?
So we have a lot of fun things to do. We have a lot of natural things that we're doing now. So for the last 20 years, it's been Botox and fillers. And now, besides Botox and fillers, we're also augmenting with more natural processes, such as PRP. So PRP is where you take your own growth hormones and growth factors out of your own blood system, and then we re-inject into the face. The nice thing about it is we can do whole face rejuvenation with one treatment, as opposed to with filler and Botox, you have to kind of choose like which area you want to do today. Now with this, we can do the whole face, so it's really amazing.
Is it where you take your blood out and then?
So it doesn't hurt at all. So we have something called Pronox, where you don't feel anything whatsoever as we're doing it. It's a very easy procedure. We do draw blood, so that's the one thing, we'd have to draw blood. But we're really good at it, and that doesn't hurt too much. So.
Yeah. Oh, awesome. Okay, I think that was pretty in depth.
Amazing.
And make sure you look at the video of Josh.
One more thing I want to talk about.
Oh, yeah.
One more preventative thing. So there's a thing that can be covered with your insurance for prevention, that is the Blue U, so photodynamic therapy. And what that is for someone who may not even know they have precancers, they can have a treatment done where you come in the office, we put a medication on the face, and then we shine a light for just 16 minutes onto the face, and it activates only if there's precancers there. If there's no precancers, you won't get any activation. So it's a nice way of treating things before there's a problem.
Oh, that's awesome.
And then one last thing I want to
keep going. We want to hear it all. I love this. This is great. We need to keep our community safe.
So one of the most exciting things we've had that's come out recently is that we have a treatment for skin cancer. When it does occur, it used to always be surgery and surgery on the face. And now we have a non-surgical option that in a private practice setting has a 99% cure rate.
Wow, what's that?
It's called SRT, and we can do it on the nose, we can do it in ears, eyelids, all the common places that people get skin cancers. Also can be done on the body if you need it on the body as well. But it's really amazing. So So very minimal scarring, no downtime. You can continue for our triathletes. We have so many people who are so active in sports, and so they don't have to stop swimming, they don't have to stop running or bicycling. They can keep doing everything and get their skin cancer treated.
Oh, that's wonderful.
Yeah.
So I just want to ask you one quick question. So I had a little piece of skin cancer here that had to get cut out a few years back, and it was almost like it seemed like it was a little zit. Yeah. And so I just kept picking it sometime, and that turned out to be skin cancer. Is that pretty common?
That is probably the most common thing that I hear is that like it looks like a little pimple or something that came up and then went by. Some people are like, I made an appointment, but then it went away, so I canceled my appointment, and then it came back, and I made an appointment, but then it went away. So like, it's like even if it is a skin cancer, we can see it when it's not active.
Oh,
we have because we have pocket tools that we use that we can find patterns. And find the skin cancer even if it's not apparent to you. Okay,
great, man. So if you feel like you've had a zit and you're not sure, come in right away, because that happened to me and it ended up having a big chunk out of my face. All right, Dr. Reed, this has been great. I really appreciate it.
Thank you guys so much for coming.
I'm a customer. Josh is a customer. I found that out the wrong way. And you've done nothing but always taken such great care of us. We really appreciate it.
Oh, absolutely.
Thank you so
much. Good
much.
to see you.
Likewise.
All right, thanks so much.